Bismillahirrahmanirrahim. I am Professor Dr.Sarfaraz Hussain Syed, serving as a Professor of Ophthalmology, I Unit 2, THQ Hospital, Faisalabad Medical University, Faisalabad, Punjab, Pakistan. We are going to examine the patient on the slit lamp and how we examine it. That is what is the purpose of this video. This is the most common procedure which we do on which we perform on the patient for diagnosis of any disease. This is called a slit lamp examination. Sitting of the patient is very important, and we ask the patient to sit so that the chin is lying in the chin rest and the forehead is lying against this rubber band, and this the eye outer canthus of the eye should be so that it should be at the level of a black mark on the left side of this chin rest. While the patient is be seated properly on the slit lamp, now we are going to examine with the slit lamp. Now, first of all, there is a diffuse illumination in which the whole of the light width and of the light and the length of the light is open against the eye, and then we examine with this the lids and the eyelashes and the skin of the lid, and also we can examine with that the conjunctiva, both the palpebral, fornical and bulbar conjunctiva, and also we can see a gross abnormality of the cornea and the iris and the pupil with the diffuse illumination. Make an angle of the illumination with observation system, also called the viewing system, and we make a slit, and this slit of the illumination is now at the same focus as the viewing system is, and with this we can see more details of any abnormality, and it can give us the width, the depth, and also the height of the that abnormalities. For example, if there is any opacity in the cornea, we can also measure with this the opacity of the cornea in detail, and also examine the other structures in detail. With additional lenses, we can even examine the fundus or the retina and the vitreous opacities, vitreous abnormalities with a lens, high powered lens, either a 78 or 90 or sometimes 60 diopter lens, in which case ask the patient to keep the eyes widely open, and we dilate the pupil with the mydriatics, and then we bring the lens in front of the cornea, and through the pupil we can examine the fundus and the vitreous, that means the retina and the vitreous of the patient with the 78 diopter lens. This is a 78 diopter. This is called fundus biomicroscopy. So we are going to examine the other eye with this slit lamp biomicroscopy. The patient is asked to look at the behind the patient, closer to. Sometimes you can ask the patient to look at the ear of the examiner, and then you can see the optic disc, and then you can see the macula. You can check the inferior retina when the patient is looking up. You can check the superior retina when the patient is looking up, but you have to bring the machine down there. So it is opposite that you have to examine with this slit lamp and this lens. After completion of this examination, we have to check the intraocular pressure, in which case we we label or we stain the tear film with a fluorescent stain. Sometimes we mix the fluorescent with the alkane, or we can use alkane and separately the fluorescent strips for staining the tear film. After we have stained with the fluorescent, we use the cobalt filter in this with a full illumination and a full width of the illumination system. This is the blue cobalt filter which we use for this. In this appears greenish, and then we see through the illumination system these green, they appear to broken rings. This is how we are going to do an applanation tonometry with this Goldman tonometer. This is to check the intraocular pressure of the eye. Okay, and after checking the intraocular pressure, we can read it from this dial, and it is about, this is the 10 and then 12, and then each graduation is equal to 2 millimeter of mercury. This is the power in the spring of which is lying inside this equipment. This is called Goldman applanation tonometer. So this is one means 10, one is equal to 10, and each small graduation is equal to the 2 millimeter. This is a Goldman applanation tonometer with which we actually check we can check the intraocular pressure. And after it appears there are two broken green rings appear in the illumination when this equipment, the cylinder or prism of the equipment touches the cornea, then it appears into two broken rings. And so these two broken rings, when they coincide, their inner edges, they coincide with each other, then this means that now this is the actual intraocular pressure of the patient. And then we read the intraocular pressure directly on this Goldman tonometer dial over there, as we have done in this patient. So the first graduation, which is 1, means 10 millimeter of mercury, and the small graduations, they are equal to 2 millimeter each. That means it is 14 millimeter of mercury is the intraocular pressure of this patient, which is equal on both sides. So this is how we do a slit lamp examination, and with this almost we can complete the examination, except that we need a few more clinical methods for other diseases to diagnose. But the anterior segment and the fundus examination, in 90% of cases we can examine with this slit lamp. Now we are going to examine the patient's refractive error with an auto refractometer. This is an auto refractometer, and we are going to refract the patient. Now the patient you should see the patient's one eye first, the right, and then the left. The patient is going to see a target in the camera of the machine. Now you have to put it on either on the automatic mode or on the manual mode. This is on automatic mode, and so you can examine it, and this will automatically take up the refraction of that eye. Now this is the right. Now we are going to go towards the left eye, and now again you have to ask the patient to look at the target. एक red color की hut है, उसको देखिए. And now here it is finished, and there is automatically you can see the print of this one. This has got also a mode called the keratometry, which is the measurement of the corneal power, and with this you can do it with this is a keratometry. Now we have done the keratometry of both the eyes, that is the corneal power, which is in about 41 in two different meridians, which is in right there is 41.12 in K1 and K2. In other 90 degrees it is 41.87, 41.25 and 41.62 in the left. So this is called a K reading or keratometric reading. This is the corneal power, and we have done both the corneal power as well as this is used. The corneal power is used for the calculation of the intraocular lens implants, as well as it helps us to diagnose the astigmatism in different diseases, especially in cases when there is a regular or irregular astigmatism in keratoconus. It gives us a reading of the astigmatism as well. So this is how we do an autoref, and then we go for a subjective refraction of the patient. Now we are going to do a subjective refraction of the patient. So this is called a trial lens frame. We have already performed an objective refraction of the patient on refractometer, and we have taken the printout, and now we have put those lenses in the trial frame, and we are going to do a subjective refraction of the patient. So we have now we are going to occlude one eye with the occluder in the frame. वो पढ़ सकते हैं क्या है?
Yes, it's clear.
Okay, now can you read the bottom line?
Yeah, ZBD.
Now can you read the bottom line again?
Yeah, OFR.
Okay, can you read the bottom line please?
OFLCN.
Okay, can you read the bottom line again please?
OHPHF.
Okay, now we are going to change the lenses to find out to refine the refraction. Now, is this one better or the previous one? Is this one?
No, this one better. This one.
With this one, it is better?
Yeah.
Okay. So, we're going to now put the other lens. We're going to change the lens now. Okay. Now, is this one better or
the
previous one is better? Okay, now this is called cross cylinder. Now we are going to check the power as well as the angle of the cylinder in the trial frame with this one. Now first of all we will check the axis of the cylinder here. So can you tell me, is this one better or this one is better? Which one?
Yeah, the second one.
This one?
Yeah.
Okay. Now this one is worse?
Yeah, worse.
Okay. This is better. So now we are going to check the power of the lens. Is this one better?
This one better.
This one is better? Okay, so we're going to change the power. We are going to reduce the power of the cylindrical power. We're going to reduce it. This one is better than the previous one,
Yeah,
is it? Okay, can you now tell me again, please?
OHPNF.
Is this one better or this one?
This one I think better.
Okay, so this is the final refraction of the right eye. Now we are going to go for refraction of the left eye. The same procedure as in the right eye. The last line, please.
OHPNF.
Now we need to put the
Previous one better.
Previous one is better. Okay, fine. So this is almost the final. Okay, now can you read the bottom line?
Yeah. OHPNF.
Okay, can you now see in the room? Do you have any problem?
No,
Do you feel any strain on your temples or
No,
you?
I am feeling well.
Well, okay, good. Now this is it. Now we are going to check the reading of the near vision of the patient. So can you read this line easily?
Yeah, I can read.
Can you read this one as well?
Yeah, I can read.
Can you read this one?
This one also.
And this one?
This one also.
How old are you?
37 years.
37. So he is doing fine without even the near, he's got a best near vision without any lenses, because he is now not about 40 years. So around 40 years you need the additional lenses to see it clearly. So this is how we do a refraction on the patient. As now we have examined the patient and all the ocular examination was normal. On slit lamp examination, on fundus examination, as well as except there was a refractive error and mild dryness of the eye. So we're going to give the prescription for refractive error, for spectacles correction, and also we are going to give some lubricants to the patient because of the dry eyes. Now this is a prescription, a standard prescription for the spectacles in which the patient's name is written here. There is a date on which this was tested and the doctor who has tested is got name over there. Now this is the R stands for the right eye, L stands for the left eye, and this is a spherical. Minus 0.25 is a spherical lens in the right and in the left is minus 0.75. There is another lens called cylindrical lens. In the right eye there is also a cylindrical lens which is minus 0.50, and an axis of this cylindrical lens is 180 degrees. Now this VA stands for the visual acuity, which is 1.0 in both eyes, which means that he has got 100% 6x6 or 20/20 vision. He doesn't need any lenses for the near vision. That is called addition. The addition is for the near vision. So that is added in this one if the patient requires this near vision lenses as well. So this is how, this is a standard card how to prescribe the spectacles. So this is a spectacle prescription.